Before you start taking Ibrutinib, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with a full glass of water, usually once daily. Swallow the capsules or tablets whole, and do not open, break, or chew them. It's important to drink plenty of fluids while taking Ibrutinib, unless directed otherwise by your doctor. The dosage of Ibrutinib is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. For children, the dosage is based on their age and body size. It's important not to increase your dose or take this medication more often than prescribed, as it will not improve your condition any faster and may increase your risk of serious side effects. While using this medication, it's best to avoid eating grapefruit or drinking grapefruit juice, as well as Seville oranges, as they can increase the chance of side effects. Women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules, as it may harm an unborn baby. Some common side effects of Ibrutinib capsule may include upset stomach, diarrhea, nausea, vomiting, decreased appetite, headache, joint/muscle pain, swelling of ankles/legs/feet, numbness/tingling of arms/legs, anxiety, constipation, dizziness, or tiredness. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Ibrutinib may raise your blood pressure. Be sure to check your blood pressure regularly and inform your doctor if the results are high. Your doctor may prescribe medication to control your blood pressure. Contact your doctor immediately if you experience any serious side effects such as easy bruising/bleeding, dark/tarry/bloody stools, fast/irregular/pounding heartbeat, unusual tiredness, swelling ankles/feet, or signs of low red blood cell count. In some cases, Ibrutinib may cause side effects due to the rapid destruction of cancer cells, tumor lysis syndrome. To lower your risk, your doctor may add a medication and advise you to drink plenty of fluids. Inform your doctor right away if you experience symptoms such as low back/side pain, flank pain, or signs of kidney problems. This medication may also lower your ability to fight infections, making you more susceptible to serious infections. Contact your doctor immediately if you notice any signs of infection such as a sore throat that doesn't go away, fever, chills, or cough. Very rarely, people taking this medication have developed other cancers, including skin cancer. Consult your doctor for more details. Seek medical help immediately if you experience very serious side effects such as chest pain, signs of bleeding in the brain or a stroke, or symptoms of a serious allergic reaction. If you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. Before taking Ibrutinib, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication contains inactive ingredients that could cause allergic reactions. You should also discuss your medical history, especially if you have had blood or bleeding problems, heart issues, high blood pressure, kidney or liver problems, or high levels of uric acid in your blood. It's important to be cautious while taking Ibrutinib, as it may make you dizzy. Avoid alcohol or marijuana, as they can increase this effect. Do not drive or use machinery until you can do so safely. Limit your alcohol intake and talk to your doctor if you are using marijuana. Ibrutinib can also increase your risk of getting infections, so it's important to avoid contact with anyone who has a contagious infection. If you have been exposed to an infection, or for more details, talk to your doctor. Before receiving any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Ibrutinib. Avoid contact with anyone who has recently received live vaccines. Since Ibrutinib can increase the risk of bleeding, use caution with sharp objects and avoid activities that may increase your risk of injury. Before undergoing any medical, surgical, or dental procedures, inform your doctor about all the products you are using. If you are pregnant or planning to become pregnant, talk to your doctor before using Ibrutinib. It may harm an unborn baby, so a pregnancy test may be ordered before starting this medication. It's important to use reliable forms of birth control during treatment and for 1 month after the last dose. If you or your partner becomes pregnant, discuss the risks and benefits of this medication with your doctor. It's not recommended to breastfeed while using Ibrutinib, as it is unknown if the drug passes into breast milk and may pose a risk to the infant. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Ibrutinib capsules. Certain medications and herbal products can affect how Ibrutinib works and may increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ibrutinib include other drugs that can cause bleeding or bruising, such as antiplatelet drugs like clopidogrel, NSAIDs like ibuprofen or naproxen, and blood thinners like warfarin or dabigatran. Aspirin can increase the risk of bleeding when used with Ibrutinib, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Additionally, other medications can affect the removal of Ibrutinib from your body, which may impact how Ibrutinib works. These medications include azole antifungals, nifazodone, St. John's wort, HIV protease inhibitors, macrolide antibiotics, rifamycins, ritonavir, and certain drugs used to treat seizures. Be sure to consult your doctor or pharmacist for more details and to discuss any concerns you may have about potential drug interactions. If you suspect an overdose and observe severe symptoms like passing out or difficulty breathing, immediately call emergency services or your local poison control center. In the U.S., you can contact the local poison control center at 1-800-222-1222, and in Canada, reach out to a provincial poison control center. It's important not to share your Ibrutinib capsules with others. While taking this medication, you may need to undergo various lab and medical tests, such as a complete blood count, kidney and heart function tests, pulse checks, and uric acid tests. It's crucial to attend all medical and lab appointments and consult your doctor for more information. If you happen to forget to take a dose, take it as soon as you remember on the same day. If it's close to the time for your next dose, then just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Ibrutinib capsules in the original container at room temperature, away from light and moisture. It's important to keep all medications out of reach of children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. When Ibrutinib capsules are expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.